Yes, good morning, Simon. Now, I just want to start by sharing some fresh data that was released by the Office of National Statistics, which says that over 50,000 people who died from COVID between January and July the 2nd, only 1% of those deaths were people who had been fully vaccinated. So that goes to suggest that vaccines do help save lives. But the problem here is that by making it mandatory for all care home workers is, in theory, a good idea, but in practice is causing quite a lot of problems. One care worker from Stoke-on-Trent that I spoke to says that she feels like the choice of getting the vaccine is being taken away from her. It's triggering anxiety in her, and she isn't convinced that the vaccine is going to be effective long term. She's concerned about side effects, and this is what she said to me.
Don't actually know the long-term effects. So that is my bottom line. Then it obviously sets off the anxieties of, because they try and force it upon me, it brings back memories for myself, which bring back PTSD and stuff, for being forced to do something with my body that I really don't want to. It becomes not a choice anymore. I was abused when I was younger, sexually abused when I was younger. So from then, obviously I had my choices taken from me. So now, then I was used as an object. Now I feel like that is almost setting that back off. It's setting my PTSD back off because the choices are no longer there. Well, you're not worth this because you're not getting a vaccine. You're selfish, actually. You're this, you're that. So it's setting off my PTSD, and it's actually bringing back anxieties from when I was younger. You know, I'm understanding the risks. I understand that people are becoming seriously ill, and I feel sorry for them and, you know, bless them. But for me, this is my choice. It should be my choice. I shouldn't have to suffer for something that they say is a choice. I'm a single parent. It's about turning my life upside down. If I cannot remain in my job role. Mentally, like I've mentioned before, my self-worth will be down here as a carer. Service users and everything, they build a relationship with me, with other carers or nurses. They build the relationships. They're about lose out as well. It's not just me, they're going to lose out as well. They're going to lose good staff just for something that should be their choice.
Rebecca Parsons speaking there. Now, she has to have her first jab by this Thursday if she wants to continue to work in the care home where she is at the moment. But she is hopeful that she might be medically exempt. So everybody has to be vaccinated unless you are medically exempt. But there is no clarity around that, what that means. That has not been made clear by the government. And this is causing a problem for the care home industry. I spoke to Jeff Butcher. He runs 6 care homes in the Midlands, and he said that they already have a problem in recruiting and retaining good quality care workers. He says that making mandatory vaccinations mandatory is also causing problems in attracting new people to join the industry. He says that care homes are already struggling with staff shortages, and heading into the winter there are going to be further demands and pressures, not just on care homes but the NHS as well. And he says this is a real problem, and it's not as simple as making everybody get vaccinated.
Across the Midlands, there are thousands of care workers who are saying they will not be vaccinated for whatever reason. They will have their contracts terminated. That will add to the huge staffing shortages that are affecting the sector right now. So we're short of literally tens of thousands of staff. So having people leaving when we can't hire people into the sector is a massive problem. The government exacerbating that staffing crisis with this by doing this is a major problem. It also, Balvinder, stops people wanting to come into the sector. So we've had a number of applicants for jobs who've then gone, I have to have a vaccination, do I? Yes, not interested. They don't want to do it. This scheme is crazy because it allows visitors, be they relatives or friends, unvaccinated, to come into the care home and sit for hours with the residents, and they're with the staff as well. So they could be spreaders. Equally, it gives carve-outs for people to come into the home in an emergency. be they contractors, be they NHS staff, be they emergency services. So it makes no sense to me.
One in five care workers have already handed in their notice, and that's according to data by the Institute of Health and Social Care Management. Now, the government have said that vaccines save lives, and as I already mentioned earlier, that out of all the people who've died in the first half of this year, only 1% were double vaccinated. They say it's their responsibility to protect the people that are most vulnerable, and they continue to work with care homes to ensure they are able to comply with the new regulations which come into effect on November the 11th. Now, further to this, they are currently having a 6-week consultation to roll out mandatory flu and COVID vaccinations, not just for social care workers, but for all NHS staff. That consultation is currently ongoing, but like Jeff was saying, there are concerns that this is going to cause problems with not only recruiting and retaining staff, but attracting them to join the sector. I mean, further to that, Rebecca also mentioned that last year in the pandemic, the care workers like herself were being applauded for putting themselves at risk, and she says, why should she lose her job because she's choosing not to have a vaccination?